Hello, I'm Dr. Robert Bastian. On behalf of all of our clinicians and staff, welcome to Bastian Voice Institute. You may be here for a problem with voice, swallowing, breathing, coughing, or perhaps for some sort of chronic discomfort. No matter what the issue, we follow a diagnostic sequence in order to be as thorough as we can about your primary concern. And I want to preview our three-part diagnostic process. Part 1 is the storyline of the problem, also called the history. Typically, we complete the history by using a questionnaire coupled to face-to-face discussion with one or more of our clinicians. This helps us to know you and moves us towards mutual understanding of your primary symptoms, questions, and concerns. Part 2 is assessment of the phenomenology of the disorder as the clinician interacts with your voice or swallowing or breathing. This second part requires no advanced preparation or understanding of your part, and in fact we'll just lead you right through it. Now after parts 1 and 2, we move to the visual examination of the actual mechanism. This third part, the visual examination, is accomplished in our video endoscopy facility. The equipment can look a little overwhelming to some, but you might just think of it as an elaborate video recording apparatus for the throat using different kinds of light. A primary tool in this room is some sort of video endoscope. To make its use as easy as possible for you, we use topical anesthesia or numbing sprays. Please note that the main reason is not for pain. It's instead to help us get highly magnified, clear pictures, not the distant or fuzzy ones we might get without numbing. We routinely spray your nose first. We have you sniff in as we spray, and this brings some of the medication into the back of your throat where you get a bitter taste. Then we often drip the same thing into your throat where it makes you cough. This is unpleasant, but not painful. A minute or so later, you begin to feel the effects of the anesthetic. Many seem not to be bothered much by that sensation, but others comment that it's hard to swallow or that it makes the throat feel thick or swollen. Of course, your throat won't really be swelling, but it just feels that way. Think by analogy of how your leg feels when it goes to sleep and how much that might concern you if you'd never experienced it before. Well, while you're numb, we obtain great pictures, and then we leave the room for a few minutes to take the scope for cleaning and disinfecting. The throat begins to tingle and wake up, and to encourage you about this whole process and some of the strange sensations, keep in mind that we follow this very same process for all of our patients all day long, and everyone gets through it. Oh, and as an aside, you can eat and drink as soon as the sensation returns to your throat, and usually that's within about 20 minutes or so. Now, we often teach and explain throughout the entire encounter with you, so it's a good idea to have anyone you've brought with you in the room the entire time. Particularly once we've done our diagnostic triad, your clinician or clinicians will organize and discuss together with you what we have learned and what we think are your best options moving forward. When appropriate, we may introduce you at this point to one of our speech pathologists so that you can undergo additional evaluation and maybe a session or a few sessions of voice or swallowing or breathing disorder therapy. Sometimes we think it's a good idea to pull together your entire consultation with us via a short video program we have developed on the subject of your diagnosis. That way you get to review the whole subject one final time. If we decide to do that with you, a staff member will escort you to another room for that further video teaching session. And that would be one of the last steps of your visit before you check out and make final arrangements for any tests or prescriptions or treatments or future appointments. Once again, welcome to Bastian Voice Institute. We're glad you're here and look forward to helping you.